Welcome in, everybody. Today's video is about joint health and joint support and joint supportive nutrients. And I have Dr. Whiting here, shed some light on it, and let's see if we can't get some answers and some better understanding about joint health and joint support. First off, what causes joint pain?
Well, lots of things. When you step off a curb and twist your ankle, that'll do it. When you fall down and smash your elbow, that'll do it. But apart from the obvious acute causes of joint pain, eventually joints can deteriorate, and it usually begins with a destruction of the soft, spongy material inside your joints called cartilage.
Perfect, explained.
And that cartilage is designed to be a cushion between one bone and the other. And every time you move a joint, every time you move your elbow, you're going to be wearing away microscopic amounts of cartilage. And that begins pretty much at birth. The difference is that when we're younger, the body has the ability to regenerate or replace that cartilage tissue. As we grow older, like with many things in the body, we begin to lose the ability to effectively replace joint tissue or cartilage. And then we have a scenario where we have a airspace between those joints. And that airspace makes the joint very unstable. Body knows that, as it is very smart. And it fills that airspace with a substance called synovial fluid. Synovial fluid is a very highly pro-inflammatory substance. So once that process starts, inflammation sets in the joint, and the deterioration of both the connective tissues, the joints, and the cartilage accelerates rather rapidly.
And so, how do you relieve joint pain naturally?
Well, if it comes down to a physiological thing, stretching exercises, mobility exercises are very helpful. As far as diet goes, there are certain things that have high glucosamine and chondroitin sulfate substances, such as shellfish and so forth. And those are specific proteins that the body can use to make cartilage tissue.
Oh, wow. And so, from what I've already know from being at the age I'm at, I know all good movement helps me feel better. But what exercises are good for joint health?
Well, again, you
just moving.
Well, moving, but if regardless of the activity that you engage in, whether it's swimming or weightlifting or golf or whatever it is, you always wanted to stretch before and after, because you want to give the joint and connective tissue the opportunity for full range of motion.
Almost kind of like a warm-up, kind of.
Yes, exactly. And
what foods are good for joint health?
Foods that contain shellfish is very good, unless you're allergic to it. But there are lots of mangosteen from various fruits. There's a lot of different things. Again, go back to try to eat a healthy diet at least occasionally.
Yeah. What are the supplements that support better joint health?
Well, the two big ones, of course, are chondroitin and glucosamine sulfate.
Yeah.
And they're derived primarily from shellfish. So people who are allergic to shellfish have a problem because they often can't take those supplements. But usually most supplements that contain those nutrients will have a warning label, a warning statement on the label.
Yeah.
But there are other things that we would want to include, which would be natural anti-inflammatory agents, which would be MSM, Boswellia extract, turmeric extract, and so forth. Because remember, the key to your joint problems and the key to your accelerating arthritic conditions is inflammation.
Yeah.
Controlling inflammation is absolutely vital for everybody because we live in such a pro-inflammatory world. But especially if you start to have early onset joint issues.
Got it. And so I know personally from personal experience that weather can affect joint pain. But what are the risk factors for developing a joint problem after the age of 50? It would seem they would go up, right?
It goes up because the body just isn't as efficient. It doesn't function as efficiently as it did. And there's a whole lot of reasons for that. That could be the topic for another discussion.
Yeah.
Certainly. Because what I'm saying is that after 50, you don't have to be compromised anyway, including joint problems. But most people are.
Yeah.
Because of the lifestyle they lived and the things they did and the things they didn't do the first 50 years of their life. But just keep in mind that any of you out there that are over 50 or 60, you know exactly what I'm talking about. There's more miles on the engine of the body, and it just doesn't work as efficiently. So at that point, you want to begin to ramp up your ingestion of key nutrients and natural anti-inflammatory agents because you're going to need them more and more as time passes.
To give you the head start.
For sure.
Well, I hope you guys found that very educational. I sure did. And thank you so much and have a great day.